Hello, good morning, and thank you for joining this live. I had to quickly do this live this morning because yesterday that I was supposed to take this live, I had an emergency and I could not come on to do it. So I'm really sorry, but I'm going to do this so that you can read and you can listen in, and after listening, you can now ask your questions. Please note that you need to be subscribed to this channel to be able to ask questions, to be able to comment, because this is typically for my employability project. This is typically for my employability project. So I'll start, and I'm going to be running this live for about 1 hour to 1.5 hours, and it's targeted to employers of labor, that is hospital owners, laboratory owners, people who deal with HMOs, and is also targeted at people who want to be employable in the healthcare sector. So if you're someone that has a secondary school degree, 18 years old, or you've been working in an hospital or a diagnostic center in the healthcare sector, and you don't have skills, you're stuck on one salary because you can't do more than the little thing they've told you to do, then this training is really for you. It will help you to earn your skills, and it will help you to do more, to help you to be able to do more, at your place of work. So we'll go right into it. And I'm going to be talking, I'll first start with what um, I'll first start with what the job descriptions and the essential skills for an HMO officer, either in a hospital or in a diagnostic center. It's or anything, any part of the healthcare sector, even in a pharmacy, because it is important that as the employer or the enrollee that you understand the role. It is very critical that you understand the role, and that you can, do, and that you employ the right person, and that you really know what that person should do. So I'll try to share my screen so that you know, you can see it. I'll try to share my screen now. Okay. So you're seeing my screen, and I'm talking about the job essentials skills for an HMO officer in an hospital. So what is an HMO officer? Who exactly is an HMO officer? An HMO officer is someone that manages relationships between hospital and health maintenance organizations, manages relationship between an hospital and the health maintenance organization, and ensures that the hospital adheres to the HMO policies and that patients receive appropriate care under the insurance plan. That patients receive the appropriate care under the insurance plan. Now, the first thing as either an employer or an employee is you need to understand the HMO plan. Yes, I know that there are many HMOs, but you can really understand the HMO plans. And this is how you can understand it. You have to know what the HMO stands for. What the HMO typically wants to do is to bring you clients, and for you to treat the clients in a very efficient way, in an efficient way, cost efficient way, without minimizing quality. They're bringing you the clients. The advantage of this for you, the diagnostic center or the hospital, is that they have reduced your marketing cost. The number of people you get in touch with also helps to build your clientele in the hospital. So the first thing I feel you should ask for is this patient on a single plan or on a family plan? If the patient is on a single individual plan, then yay, you've made it. You will have to find a way of getting the family to get on that plan. because that means more enrollees for you. At this stage, if as a diagnostic center and all of that, if your total number of HMO patients is not up to 100, you really need to work to make it 100, because it's a game of numbers. And that is why you need someone to specifically place in charge of this work. The moment they are 100, then it means that you can begin to try to maximize. One of the ways is to market them and ensure, try to get them to register with the HMO. So if they registered only the client, then try to get them to register their family. And you can have this arrangement with the HMO. You can tell the HMO, if I bring you more clients, what is in it for me? So one, when you bring in these clients, they're going to be for your own hospital, most likely. Then second thing, you can have an arrangement with the HMO on commission and all of that. So you're increasing the number of people. Three, you are building trust for the people that will come into your hospital. Because guess what? Some people's HMO plans are based on their work. So, and nobody's going to work anywhere forever. So you're building a relationship such that even when they are no longer working at that place, they will still remain your clients because they've had a good relationship with you. So when you have this HMO officer, the your work is not only to treat them, your work is to tend them. Tend them. When I mean tend, you need to make them your clients. I've seen that a lot of healthcare organizations regard HMO clients as second tier, as, oh, these people that pay capitation, they don't pay us a lot, and all of that. But no, it shouldn't be like that. You have to treat them as your clients. And why am I saying this? When you treat them well, they will talk about your hospital. They will get more people to enroll in your hospital. But besides that, is that you should know that an HMO plan doesn't cover everything. So when an HMO plan doesn't cover everything, when there is an opportunity for them to do extra things, they would ordinarily do it with you. They will ordinarily do it with you. So that again is another way, to expand your client base. So I don't want you to treat the HMO patient as an HMO patient, as a second class patient. They are actually customers, potential customers, waiting to bring people to you, waiting to bring their families to you. So let's go. The other thing, like I said, is that you have to understand the plan. You have to understand the plan of the HMO. And as the medical director, as a senior staff in the organization, that is not your work. You need to have someone dedicated to do that. And for those of you that are employees, this is a skill you need to understand. And that's what we're trying to do today for the next hour. So, what does the plan offer? The first thing, for all the HMOs that you have with you, get all their plans. Have a knowledge of, there's a sheet that contains all their plans. So ask the HMOs from the time you are signing an agreement with them, let them show you all the plans they have so that you already have it. Whether you have 10 HMOs, 20 HMOs, have a different folder for each of them. A different folder for each of them. Now, when you've done that, have all their plans, like a sheet of paper, in that folder. When you have that, when any patient comes and the patient says, the plan will start from maybe bronze, gold, silver, or essential, people name it, but you know that there is a first plan. There's a second plan. There's the cheapest and there's the most expensive. So what that does is that when you have all the plans, when someone tells you she's on a particular plan, you already have an idea of what is going to be covered. Most of the HMOs, their plans are similar. So you already have an idea of what is going to be covered. And people on these low plans, many times they come for things that are not covered on the plan. Or number two, they may be exceeding their limits. So it puts you on an alert, because as an hospital, you must make sure that you have your claims perfect, because that's where the real problem, to have a perfect claim redemption system. So besides this, you must also have your claims register for every patient that comes into the hospital and is an HMO patient. Yes, there's a lot you do online. You can lift it from online, but I also know that, you know, HMOs use different systems, and sometimes you may not be able to really articulate that when the patient is in front of you. So you must have a register where you record. That's the work of the HMO officer. The person records every HMO patient that comes, the name, the HMO, of the person's HMO, the service, whether fee for service or capitation, then leave the space for the claim, and then when the claim is redeemed, that you must have that paper so that you are ticking it, and at the end of each week, you are looking through and you're checking which ones have we done, which ones have we not done, which ones have been paid, which ones have not been paid. So this book works between your front desk and your accounts. The book works within your front desk and your accounts, so that the accounts, they're doing the billing and all of that, but from the front desk they can say what is going on, because that's where you can get the information. Accounts, billing, they can be overwhelmed at times. So when we have that, so you're looking at getting an HMO officer that will be able to do this thing. So the person must be able to communicate well, and the person must be able to write. You understand? And that's why I'm saying this job, if properly trained, you may need to have more than one, and you don't need to, in quotes, go for a university graduate. If people are well trained, it's something they can, because it's a system, and that system has to be understood, properly understood. And also for you to know that sometimes you may need more than one person to do it, because it's an administrative process. Albeit simple, you may need more than one person to do it. And that's why it's good to train even low matured school leavers, people with a little experience, people that you probably have been using as auxiliary nurses, but that you find are sharp and smart. They can actually be trained to do this. So you now go to the next, and I'll go to the next part of it. So the HMO officer has to be in touch with all your HMO patients. And when I mean being in touch with HMO patients, I mean there has to be a line of communication, either phone call, SMS, or I don't want to say visitation. Visitation is not bad, but phone calls and SMS are very critical. Excuse me. So phone calls and SMSs are very critical. This is because you need to have a connection with your HMO patients. And the essence of the connection is marketing and customer service. You need to have a relationship with them. I put referral codes because I also want you to be able to generate referral codes prior to when patients come into hospital. Part of the problems of satisfaction is that a patient comes in, tells you what is wrong. You already know that the patient is going for specialist care. Then you start waiting for referral code generation. If you're in touch with your patient, either by SMS, WhatsApp, phone call, and the patient has said, you know what, I'm coming for maybe a surgery, or I'm coming for a procedure, you already know that this procedure is not covered under primary care. So you are already requesting for the code generation, so that by the time the patient is coming in, you already have the code and you're just going ahead to do the job. So, like I said, once you have an officer and you have 100 HMO patients, you need to get an assistant for that person. And the assistant doesn't need to be high level. The assistant can even be someone working remote, but you need to, because the aim is that you must be able to explain the plan to the patient. Yes, the HMO has already explained it to the patient, but you must be able to explain it so that you don't get into constant, am I covered, am I not covered? So you must have a proper understanding. And if you do not, you can actually request the HMO to come and train your staff on their plans. I'm sure a lot of them have pre-recorded stuff that they can send to you. Then when you are in good terms with your HMO patients, then you can market it to the remaining family, because they will have seen that, oh, this is a good this is a good plan. And let me tell you something, health insurance is good. Let us disabuse our minds from the fact that it is not good. We just need to get the administrative process well, and we need to be involved. We need to be involved. So as an HMO officer, if you're going to be an HMO officer, you need to understand all of that. Now, what are the responsibilities? What are the things you're going to be doing as an HMO officer? Or if you're an employee, what are the things that you expect, that you should be able to expect the HMO officer to do? Please, when you employ an HMO officer, don't just tell her or him, you are going to be liaising with the HMO. No, you need to list what the person is going to do. Tell the person, this is the report I expect weekly. This is the report I expect monthly. If you don't do that, you're leaving a lot of things open and you're still going to be the one doing the job. So we can see liaising with HMOs, we can see claims management, we can see patient coordination, we can see policy compliance, and we can see reporting and documentation of claims. I won't be able to take this one by one, but I will just take you through the what it means. I'll just take you through what the person needs to do. So you are as the HMO officer. The HMO officer is the start and finish of the process with the HMO client. Start and finish of the process with the HMO clients. You take them in, you find out what they want to do, and you make them proceed into maybe the vital checks and all of that. You guide them through the hospital. You guide them through it. So, oh, madam, once you're done with this, I'm going to hand you over this form. You're going to go for your vitals. From your vitals, you go and see your doctor. Then when you've seen your doctor, then you come back to me to sign before you leave. So you are the one managing the person 360 degree. That is what the HMO officer should do. And that's why I said the HMO officer should be smart. And depending on the total number of clients that you have, you may need to have more than one. However, they don't need to be very high level staff. They're people you can train, such that you don't want them to have any challenge, as they navigate into, because when you have too many patients in the hospital, there is bound to be chaos. But if people are well navigated in the hospital, it's fine. It saves cost. It reduces the time they spend within the hospital and makes your staff focused on other things that they have to do. So that's why I've said HMO clients, treat them like your own clients, because they are all potential clients. And of course, if there are services that are not covered, you can also introduce it to them. So they're not second hand client. So the HMO officer, that is what you need to be able to do. You're going to follow each HMO patient, even when the patient has left, up until the point that the claims has been written and the claims have been paid. So you know, depending on the agreement you have with your HMO, how long it takes them to pay the claim. But I want to say it's also directly proportional to how soon you send in the claim. You understand? And for some, it's automated. So those are not things that you leave till the next day. Part of the things you need to do before closing is to ensure that for all the HMO patients that come, you have sent in the claims. Make it a daily thing. Stop piling, because when you pile, there's a tendency that you forget. And that's why I said getting the code, the authorizations and all of that is a process that can even be done before the patient comes in, especially when you are sure that the patient is coming for secondary care. So that's one thing. The other thing that you need to know as an HMO officer is that you need to be very cautious, because there are a lot of people that you need to talk to, you need to allay their fears, and that's why I said you need to understand the plan. So you cannot be talking to someone about a plan that you don't understand. You don't know the benefits. You don't know what are not the benefits. So I don't expect that you'll be able to cram everybody's benefits. But at some point, when you've done the job, you will understand which benefits, that you want to, that you can, which benefits that the person will be due to and the ones the person is not due to. So there are some essential skills that as an HMO officer, you must be able to. Top of it is communication. You must be able to convey accurate information to patients. Top of it is communication. You must be able to convey accurate information to patients, to hospital staff, and to HMO representatives. So you, as the HMO officer, must have the HMO itself, as your friend. So you already have a number, you understand, and you are communicating with them. Sometimes you may need to form a WhatsApp group with each HMO, just so that your information is transferred immediately and you can get immediate resolve. You can get immediate resolve of different for different HMOs. You must also have analytical skills. You must be able to analyze claims. You must be able to analyze reimbursement trends. You understand? There's something that is called diagnostic related groups. What I'm saying is that, so when patients have malaria and some sort of there's some sort of maybe on admission, maybe the person has severe malaria, you should understand that the claim will be within a particular range. You understand? You must understand that the claim will be within a particular range. And as such, you must be able to work on it. So part of what I want to share the I want to share the slide on the competence, and I want you to take some time to look at what are the skills that you need as a communicator. So communication, analytical, problem-solving skills, attention to detail, and knowledge of health insurance policies. I want you to be able to read it. You may want to jot it because this is not available. I'm not going to send this to anybody. So you need to be able to do this. So take 1 minute to look at this. So, like I'm saying, to learn the skills, you need to be properly trained, and it's not difficult. Analytical skills are things that you get over time, and you need a lot of personal study to be able to get analytical skills. You need to be able to watch trends and see exactly what what it looks like. So, like I was saying, when when someone has done antenatal care, you should be able to say this is an idea of what the bill is going to be, so that when there's any problem with the bill, you can quickly spot it, because anybody can make mistakes. And as the HMO officer, you must be able to ensure that the hospital or the diagnostic center gets almost all its money back, especially from claims. And to be able to get this, it means your claims must be detailed. It must be detailed, it must be meticulous, it must be well documented. You must put every evidence, you understand, on it. And sometimes you may need pictorial evidence. So sometimes when you are treating a patient and you're looking at that treatment, you're already looking at this treatment, will we be able to get our claims? Because we're doing a lot for this patient. You may need pictorial evidence to be able to slug it out with the HMO when the HMO is trying to tell you they're not going to pay for some things. You may need to do that. Then, like I've said before, knowledge of insurance policies is very critical. Knowledge of insurance policies is very critical. So from there, we will go. Time is really fast. What are the qualifications that you need? Like I said, certification in health insurance and healthcare business support is what you need. If you're a graduate, then it's easier for you because you'll have learned a lot of things. So you'll be vast with a lot of things, communication and all of that. But if you're not a graduate, then you need to get some sort of certification in healthcare administration, healthcare business support, healthcare management, something to just show that you understand these things, then you can begin to learn on the job. So there are some challenges that HMO officers will face, and which hospitals, when the HMO officer is facing a challenge, then the entire hospital is facing that challenge. So dealing with diverse and complex insurance policies. So some insurance policies are difficult. When someone comes, they say, oh, this policy, this plan is something plus, maybe gold plus. That person also has BUPA, as international evacuation. Sometimes you don't know when to draw the line. So sometimes it can be complex. And that's why I said for a lot of the HMOs, you could, especially those that have complex policies, you could form a WhatsApp group with them so that when you have any challenge, you can quickly just message them. Because sometimes emails, don't fall into the face of people. But WhatsApp messages, Telegram messages falls into the face of people, and it's much easier, for people to see. Managing high workload, handling multiple claims, patient issues, and HMO interactions. So there is high workload, and the way you can do it is the company can take interns. Interns are people that are out of their maybe they're on holiday job and all of that. They can come and help because they can help to manage the workload while you handle the very serious one. Then, of course, ensuring patient satisfaction. This is another thing that I've seen a lot of people don't do. You are supposed to do it. It's a quality issue, and every organization is supposed to do it. So the major importance of an HMO officer is financial impact. So when you go to somewhere to work as an HMO officer, part of the things you need to know or do is to say, when I arrived, how much was the organization making from their HMO claims, their capitation and all of that? In 1 month, 2 months, 3 months, how much are we making? As in, look, all things being equal, and looking at saying we're having like same rates of patients coming in. Two, you must make sure that your organization is not involved in fraud. A lot of organizations get involved in fraud. A lot of organizations get involved in fraud. So you must make sure your organization doesn't get involved in fraud. It's very critical, because once you get involved in fraud, then at some point you're going to have people, at some point you're going to have people, you know, thinking that any other thing you send, thinking that any other thing you send is fraudulent. You're going to have people thinking that every other thing you get is fraudulent. So, an importance of HMO officers: enhancing patient care, lesson, enhancing patient care, financial impact, and compliance. Very critical. Very critical. Those three things are very critical. So you must be able to do that. Once that is your KPI, You understand? You must make sure that your hospital does what is right as regards compliance, regulations, policies, no fraud. And I keep on saying it, no fraud. Once there is fraud, once you start writing things that the hospital did not do, then it means that you are now put on the hot list of the HMO. You're now put on the hot list of the HMO, and anything you send, even when it's even when it's right, even when it's correct, the hospital is going to, the HMO will think that all the time it's not the real thing. So that is very important. So I'll go to the next aspect of it, which is optimizing HMO operations, a quick guide. I wrote quick guide because HMO operations is not something that you can just talk about, within an hour. But I just want us to understand it. So whether you're aspiring to be an HMO officer or you are already someone who is already having HMOs, and you are unhappy, because a lot of I know that a lot of organizations are unhappy. They are um, unhappy because I'm sorry, I'm just trying to get this on. They're unhappy because they're not really doing well. Do you understand? They're unhappy because they're not really doing well when it comes to the operations. We don't really understand it. You understand? We don't really understand it. So um, I'll be talking about optimizing HMO operations. Optimizing HMO operations. I'll be talking about that. So for a lot of organizations, sorry, I need to stop sharing this so that we can have, um, okay, okay. I'm sorry, I'm just trying to exit this. Okay, I think what I'll just do, I need to go ahead with the presentation, is optimizing HMO operations. I'm just trying to give a guide to how we can optimize HMO operations. So for me, I'm looking at a situation whereby everybody understands how it works and everybody clicks on how um, how they can best benefit from it. I want to talk to the healthcare provider. I want you to have a very open mind about HMOs. Have a very open mind, because there's so many things you can gain from an HMO. An HMO is like a direct source of marketing for you. So you have to keep a very open mind. I also want you to try to gain as much as possible from your HMO. Make them your friends. They're available to give you financial advice, operational advice. They're available to do all of that for you only if you ask. And I'm saying this from the background of the fact that I've actually worked in the HMO system. And in the HMO system, I've worked as a provider manager. That means at some point I was enlisting hospitals into the HMO. I've worked as a client relations manager. At some point, I was relating with the client via the HMO. You understand? And thirdly, I've also worked as a marketer. So I have a full view. But what I've found again is that sometimes, we're so happy, we're so angry, with the HMOs that we see nothing good in it and we are grudgingly working with them. The first step, like I would say, is that know your worth as a provider. You need to know your worth. And what I mean by knowing your worth is that, is what the HMO offering you, is it your worth? That is the first thing. If you feel that what they're offering you, you are worth more than that, then sit down with them and let them tell you why that is what they are offering you. That's the first. The second thing is also, as a provider, ask your friends what they are being offered, because these HMOs, they're the ones coming to you, coming to other people. Ask your friend what they are offering. So sometimes they're offering hospital A, maybe they're putting them on A group hospital, then hospital B, they're putting you on B group hospital. You need to ask why. If you know the why, then you can know how to improve yourself. But if you don't know the why, you're just self-judging yourself, how do I put it? Self-evaluating. The best evaluation really is, what are people, I mean, logically, what are they saying about you? Sometimes the evaluation of your hospital or your diagnostic center can be on the number of tests you can do, the number of procedures you can carry out. Sometimes it's even by location where you are. Maybe people just want an hospital in a particular location. So the hospital in that location will tend to have a higher rating. Let me give an example. An hospital in VI will have a higher rating than an hospital in Surulere. Why? Because they know that the rent in VI is higher. You understand? That's one. Two, they also know that because there are a lot of offices there, a lot of people will want to go to the office, from the office to the hospital. So there may be more clients requesting for that hospital. So even on VI, there can be two or three hospitals and their rates will be different. Sometimes again is by aesthetics. Some hospitals are hotels and you know what it is to pay for an hotel. So, you need to look at it and take it as a learning point. But let me also say something, that wherever your hospital falls is not a disadvantage. There is always an advantage in that area for you. So if your hospital falls, or your dad falls in a low income set area, then you have the numbers. So you can have the numbers, and there are a lot of things you can do to encourage the numbers. If it falls in the high income area, you may not have the numbers because they may be registered, but they may not be there. They may not come. Like I'm on a health insurance plan. I don't really go to my hospital. Sometimes 3 months I'm not there, because if I have a headache, I get into the pharmacy, I buy my paracetamol. I don't want to go and spend 30 minutes, 1 hour just to get paracetamol. You understand? But those at the other side, even if they're just having stomach pain and they know that they will have an opportunity to come to the hospital, they will come. So you have to look at it both ways. Use my how can I use what I have? How can I use it to further make my business better? Because this healthcare thing is a business. How can I further make it, So you look at that, and we're looking at when you want to optimize your HMO operations, four things that you must know. Number one, you must understand the HMO organization that provide healthcare services for a fixed monthly premium. Fixed monthly premium, I know there's been a lot of talks about about that, which we call capitation. I mean, health insurance organizations are paying from 300 maybe to 1,000, and some are just even doing fee for service. You have to take each organization in their own stance. You also have to be futuristic and think that this HMO, if I partner with them, what's the future? What does their future look like? Those are the kind of questions you need to ask your HMOs. Let me also tell you, as an organization, as a hospital, you have the right to have a stakeholders meeting with your HMOs. You can call in all your HMOs and have a meeting with them. They are not always the ones that must call you in. Many times we put ourselves at the other side. They're not always the ones that you can call them in and have heart to heart discussions with them. They are humans, you know. Then the provider network in HMO system, the provider network is a network of healthcare providers that provide care to their members. The main aim of health insurance, HMO, is cost containment. And you as the provider, you must be a master in this. And being a master in cost containment includes things like how you procure your drugs, how you dispense them. And I want to mention something. People feel that, oh, HMO patients are given drugs that are not that are substandard and all of that. No. Sometimes the way you present drugs makes them look so. It's not because the drugs are substandard. The way you present them makes them look so. But I won't go into different more details. Then again, as a hospital, you must be able to implement preventive care programs. Preventive care programs. Then, of course, a fundamental of HMO is that patients have a choice of the provider they want to work with. So it's not a function of what patients have a right. You understand, to the provider they want to work with. Who do they want to work with? They choose who they want to work with. So patients have the of who they want to work with. So that's what you get. So you have to understand the entire fundamentals of the HMO, the provider network, what the HMO does, cost containment, and patient's choice. Patients have a right to choose who they want to work with. Now, the next thing you have to know about HMO is, what is the workflow of an HMO? What is the workflow of the HMO? What is the workflow? What happens? So this is the workflow. This is what the workflow looks like. There is patient intake and enrollment. So you need to, as a hospital, be able to say, this is what it is. Who is going to be in charge of patient intake and enrollment? So it's not everybody. Yes, I know that sometimes you see three people at the records. You understand? One person is trying to do this, one person is trying to do that. But once you are able to dedicate someone to the HMO patient, it's always better, because that person takes it through the entire flow. Patient intake and enrollment, then of course, authorization and referral management. Very key, very important. The person must be very good with technology, emails, phone calls, WhatsApp. Even for some organization, you can even get them on Twitter. You understand? If you want to get them early, depending on the channels they've given you. Authorization and referral management, very important. Claims processing and payment, very important. How do you do the claims? So if you feel that you also have a large volume of HMO patients, then you can split the intake, enrollment, and authorization to a particular person and leave the claims processing, payment, and quality management and reporting to another person, so the two of them can work hand in hand. So you just train them to do that so that it can be fast. Like I've said, every single day, every single day, you must ensure that your patients, you must ensure that your patients are having the shortest time possible in the hospital. Shortest time possible in the hospital. For you to be able to manage HMO properly, you have to leverage technology in the hospitals now. You need technology. If you're doing paperwork, yes, paperwork can work, but it will take time, and it may reduce your efficiency, satisfaction, and even your claims management. So you need to leverage technology. You need to use electrical health records. You need to use an EMR that has the HMO tab. Very important. But even with technology, it's a human that directs the technology. So if something is lying in the system and there's nobody going to get it off the system, then you will see that you have it in the system, money is lying in the system, and you are not using it. Again, you must also be able to use telemedicine, even as the hospital. And that's why I said you must communicate with your clients, even when they're HMO patients. Take them as your clients. You must have the way you relate with them. You can call, you can SMS. There must be a relationship. There must be a dashboard. When there's a dashboard and there's a relationship, the truth is that they're not going to come to the hospital as often as they should come. So that capitation remains in your pocket. But when there's no communication, there is no way they can reach you unless they come to the hospital. They're going to keep on coming. And when you have a lot of patients, a lot of resources are going down the drain. You have to put on two generators at the same time. All the lights are on. All the staff are tired. But when you are in constant communication with your patient, what you have done is that you try to keep them healthy at home or wherever they are. You understand? And that is by making you can make virtual care available to them. Then again, you have to analyze your patients, which a lot of us don't do. At the end of maybe quarterly, may not be okay to do it monthly, but maybe quarterly, you want to find out who are those that have come to the hospital, who are those that came once, those that came more than once, who are those that had serious medical issues. You want to do the data analytics. You want to know what is going on, and you want to reach out to them. And at the same time, you can use it as a bargaining power for your HMO. So if you're having people that are subscribing to your plan and a lot of them are hypertensive, you understand, a lot of them are hypertensive, then it means you have to keep on having claims for antihypertensives if you are the one giving the drugs. You understand? But if you're not the one giving the drugs, like I said, the HMO system is an open system. Even if you're not the one giving the drugs, do you know that if you can match what the rate at which the pharmacy is giving the drugs, then they can consider you. So, like I said, this friendship, this collaboration with an HMO is a big ocean, very big ocean, and you're the one that will determine how it works, how it's going to work. The enhancing HMO efficiency, we have process automation. Like I said, technology is very important. Data-driven decisions, data very critical, and continuous improvement. You continue to train your staff. One way that I know that helps is in staff training. A lot of times people call me yesterday, Dr. Yetunde, come and train my staff on this, come and train my staff on customer service, come and train my staff on marketing. I need ideas of how to make my hospital better. I want to revamp my hospital. I want it to look good and all of that. But the question is, even those within, you must be sure that what you're doing for them, they're able to give it back in return to people in the organization, that they're able to give it back to people in the organization. And I'll tell you how I want you to look at this. Conduct in-house trainings. When you conduct in-house trainings, it helps all the staff to, they'll criticize each other and say what we're doing well, what we're not doing well. A lot of times as hospitals, as diagnostic centers, as healthcare institutions, we don't even have time to have meetings. And when we have meetings, it's centered around very mundane things. They didn't sweep well. Madam something came late to work. They are around mundane things. Whereas the things really bringing the money into the hospital is left behind. So sometimes when you want to have an hospital meeting, get the HMO officer, tell her, today you're going to teach us about HMO, and that way you're going to know what are the gaps. You understand? Get the billing officer, if there is the HMO billing, if there's a billing officer, tell the billing officer, come and provide the data of our HMO, um, either spendings or resources and all of that. I always emphasize, I always tell organizations to keep separate accounts so that you can monitor well. Keep separate accounts for HMOs and the ones for your private patient. That really helps you to know what is going on so that you're using that money and you're knowing that I'm removing money from my private to actually work on my HMO patients. It helps you to have a balanced view. It helps you to have a balanced view. Another area I'm going to talk about, I think I have just about 10 more minutes to the end because it's just going to be 1 hour, is branding. Branding of your hospitals. Why is my hospital, why are they giving me, why are they telling me that my hospital is band C? Why are they telling me my hospital is band E? You know, let me first say that no matter where your hospital is, you have a tendency to take your hospital at least 2 notches higher. 2 notches higher. A lot of times we do a lot of things, but we don't do it well as healthcare institutions. And I'll be very honest, we don't do it well. And that is where I call branding. Many of us, it may sound funny, but the name of our hospital, in quotes, doesn't have any meaning. Do you understand? So look at someone that says, my hospital is foremost care hospital. What is that telling people? Foremost, best care hospital. Do you understand? And let me come to maybe those that are using um, maybe Yoruba or Igbo, or do you understand? Yes, I'm not against it. But what you named your hospital, what does it mean? If you name your hospital Itura Hospital, Itura means like you're just cool, things are going fine, It's a good name, but you must be able to communicate because we're in a country where it's a mixed breed. So depending on where you are, you must name your hospital accordingly. Do you understand? So let's start with the name. Then we go to the next thing. How is your hospital represented? You go to some hospital, everything is haphazard. You must represent your hospital properly. And I tell you, the best way to represent your hospital properly is make sure, if you cannot use good brand colors, please paint your hospital white because that makes it look neat. And whenever there's anywhere that is dirty, you can always repaint. But to be seeing red, pink, blue, there's this blue paint that looks really horrible. And you go to the moment you see it, the spirit of a patient works first with what the patient sees, then before even the patient starts to interact with the hospital. There are many other aspects of branding I may not be able to talk about, then the logo, then definition of services, then we're talking about the inside branding. What does it look like? I don't want to mention names here, but I've been to more than 100 hospitals in Lagos. Take it from me. So I know what I'm talking about. Then your hospital convenience. There's always a convenience for patients, and there's the one for staff. The one for staff is always under lock and key. They are keeping it clean. But the ones for patients, how does it look? Many times when the HMOs even come to inspect, some of them, they just go straight to the toilets, and that's it. That's what they use to determine the level of your hospital, because there's a certain standard that is expected. So the branding of your hospital is very important. It's critical. And I've not come to the scrubs. I've not come to how you deliver your medications. I've not come to your communications. I've not come to your digital marketing. I've not come to your website, your pages on social media. Very critical. Very critical. If you don't have a website, you don't have a social media page, then you're still You're still trying to, when you don't have all of those things in place, then it means that you've not yet achieved 50% of what you're supposed to achieve in financial gains. 50% of what you're supposed to achieve as financial gains. Then you, the MD, what do you look like? What do people see when they see you? How do you relate with your patients? Are you a medical director or a managing director? There are two things. Are you the CEO or the medical director? Sometimes you may need to take a CEO and remain the medical director so that the CEO can oversee the functions of the hospital. While you are the medical director, but you're a board member, so you're still above the CEO. So all of those things are just nomenclature. They're just nomenclature. So as I wind down on this training, I just want both the hospitals and for those looking for employment, there's a lot of opportunity in the healthcare space, a lot of opportunity. Over 4 years, I have trained 300 young people. 300 young people. And today, more than 60% of them are in employment in healthcare institutions. Some of them didn't have more than WAEC, some were OND, some were even graduates and they had never worked because they just didn't know how to go about it. And I said the healthcare organization is very green and there's a lot of opportunities for employment. If you are on any of the forums, where medical jobs are posted, you see that day in, day out, people are posting jobs. That people are posting jobs doesn't mean there are vacancies, but it means that they're not satisfied with the person holding that seat. So the opportunities are there. So I'll admonish us that after this is just an appreciation training. If you want to deep dive into it, maybe you want a training for your in-house, for your hospital, or you want to attend our upcoming training, which we've not decided what time, you can just send a mail and we will see how we can arrange that. But apart from this, I just want to say thank you very much for watching. Thank you for bearing with me because I wasn't able to take the last the training that was supposed to happen yesterday night, but I'm happy I was able to do it. And you can always watch, you can comment, and you can subscribe again to the channel. I'm sure that I'll be coming up with a lot of things to learn: communication skills, healthcare marketing, healthcare digital skills, healthcare branding, so much more, even how to financing. We're going to be talking about so much more in a language that you understand, because the aim is employability for the young ones and also prosperity for those that have hospitals. Thank you very much and have a great day today.